Chiari malformation is where there's not quite enough room in the back of the brain, and that can cause a problem with the spinal fluid not getting out of the brain appropriately. And all of us, we make spinal fluid in the brain in what's called the ventricles, the spinal fluid filled spaces. That spinal fluid circulates around and then drains down into the spinal canal at the base of the brain. If there's not quite enough room congenitally, then that spinal fluid doesn't exit properly, and it can cause a host of symptoms. You can develop a fluid-filled cavity within the spinal cord called a syrinx that can cause numbness, weakness, trouble with balance, pain. A person can also have severe headaches because the spinal fluid doesn't exit properly and the pressure goes up in the head. And so that is definitely a surgical issue, and it's curative. What I do is to make an incision in the back of the neck, in the lower part of the brain, of the skull, and remove some bone, and then sew a patch in that creates a more normal room in the back of the brain. When that's done, then the spinal fluid circulates normally, and symptoms go away. The syrinx itself will go away once the impetus for the spinal fluid to circulate abnormally is gone. And this is one of the problems that has gotten so much better in recent years from technology, because now we have patches and material that we can use to create a seal. The bane of this surgery in the past was a spinal fluid leak, and a lot of people had to be readmitted for drains and those type of things, and now that's become thankfully very rare because of some of the patch material that we have that increases the efficacy of the surgery.